Peace be upon you. Imagine discovering that if for 3 persons over the age of 40, one of them is living with a disease they believe behind their control. It is type 2 diabetes. But the question here, it is inherited or acquired. And more importantly, it is reversed or not. So in this video, we will reveal and tell the story about the true cause of the type 2 diabetes and what we can do about it. Type 2 diabetes is acquired, so lifestyle factors, which mean it is preventable and in many cases reversible also. But how does this happen? Type 2 diabetes equal fatty liver plus fatty pancreas. Fatty liver lead to decreasing insulin growth factor 1, and fatty pancreas, that means decreasing insulin production. Please, we want more details to understand this. Alright. The liver is the central organ that can convert triglyceride into glucose and glucose to triglyceride. So if this process result amount of the lipid entering the liver more than the amount of lipids removed from the liver, this means fatty liver. This is logic, alright? But why is the amount of the lipid entering more the amount of removed? Is also is 4 main causes of fatty liver. 2 main causes: increased entry of lipid into the liver, food toxicity, that means overeating of carbohydrate, and this is toxicity, that means chronic anxiety and depression. And 2 main factors that decrease removal of the lipid from the liver: light toxicity, prolonged exposure to the light at night, and disturbance of the sleep, and lack of the physical activity. Please, also at this point we need more details to understanding that. How this factor leading to the fatty liver? Excess carbohydrates. Number 1, when you consume more carbohydrates than the body can store as glycogen, where the glycogen is limited, where it is needing more water content, so the body convert excess carbohydrating to lipid in the liver. When this happens at the rate faster than the liver can process and remove them from the liver, this results of fatty liver. This is the first cause. But we ask here, why can diabetes occur in non-obese individuals? While obesity is a significant risk factor for type 2 diabetes, non-obese individuals can develop the disease due to other factors. Second important cause is stress, and the stress is the main cause for diabetes. Stress stimulates the release of hormones like adrenaline and cortisol, which increase the fat breakdown and mobilizing lipid to the liver for conversion into glucose. A chronic stress results in continuous influx of the lipid into the liver, contributing to the fatty liver. And also there is 2 other factors which decreasing exit of the lipid from the liver. Light toxicity. Nighttime is intended for sleep, but with artificial light, night has become like a day. The use of mobile device at night send signal to the brain that is the daytime, suppressing nighttime hormones that aid in the lipid metabolism. The suppressed reduce the removal of lipid from the liver. Sedentary life also the main cause in this, where the brain primarily using carbohydrate for energy, but the heart and muscle prefer fatty acids. Sedentary lifestyle decreasing consumption of these fatty acids, leading to their accumulation of the liver and contributing to the fatty liver. Alright, so what's link? We're not understanding until now what's link between fatty liver and type 2 diabetes. Alright, fatty liver leading to decrease of insulin growth factor 1, insulin like hormone secreting at night by the liver to enhance fat consumption. So when occur fatty liver, that means decrease insulin growth factor 1. So occur in the diabetes nighttime hyperglycemia before daytime hyperglycemia, and occur also complication of diabetes like retinopathy and nephropathy and retinopathy maybe at onset of hyperglycemia. Why? Due to decreasing insulin growth factor 1 and accumulation of lipid and complication of increased fatty acids in the blood. Lead to insulin resistant. Why? Where triglyceride free fatty acid stimulate insulin, where insulin the hormone of storage. This stimulation lead to hyper secretion of insulin, hyperinsulinemia. To prevent hypoglycemia, insulin resistant develop as a compensatory mechanism, where if insulin is the same sensitivity present in the GLUT4, this means the patient entering in the hypoglycemia. So the insulin resistant is compensatory mechanism for hyperinsulinemia. Accumulation of the free fatty acid in the blood vessels contributing to hypertension, coronary artery disease, and stroke. Additionally, fat can accumulate in the pancreas, leading to fatty pancreas and ultimately diabetes and decreasing insulin secretion. So in conclusion, 4 main causes lead to fatty liver and increasing blood fatty acid and triglyceride. Insulin lead to insulin resistant, lead to fatty pancreas, type 2 diabetes. Therefore, lifestyle modification are crucial for preventing and management of type 2 diabetes.